This enhanced running technique video examines posterior pelvic tilt. The normal degree of pelvic tilt should be 5 to 10 degrees in the anterior direction and measured at toe off, as is seen in this example here. A posterior pelvic tilt is often seen alongside with a decreased lumbar lordosis. Some of the considerations for a posterior pelvic tilt include that it shifts the centre of mass posterior and therefore running in the back seat, and then they'll also be landing further out in front of their centre of mass. A posterior pelvic tilt can also limit the hip extension and often limiting it getting past zero, which will cause a shift in the leg recovery pendulum, leading to overstriding and an increased loading on the knees. The posterior pelvic tilt can also potentially increase load in the low back, and it's not very efficient for breathing and pelvic stabilization. Flexibility of the abdominals and the hamstrings and strength of the hip flexors needs to be considered and assessed. Correction includes improving flexibility of the abdominals and hamstrings in addition to strengthening the hip flexors if deficits are present, and also postural cueing to prevent posterior pelvic tilt.